Dear students, welcome back. In the previous session, we have finished the shoulder complex. Now in this session, we are going to start the elbow complex. As you people know that we have studied in anatomy as elbow joint separately and the radio-ulnar joints separately. Here, the elbow complex means it includes some joints here. So it includes the elbow joint as well as the proximal radio-ulnar joint and also distal radio-ulnar joint. So all these together called as elbow complex. So the elbow complex includes the elbow joint. Normally the elbow joint includes the humero-ulnar joint. This one is humero-ulnar joint and radio-ulnar joint forms the elbow joint. And in this elbow complex, it also includes the proximal radio-ulnar joint and distal radio-ulnar joint. All these joints work coordinately to enhance the function of the hand as well as the shoulder. Okay, here now we are going to see in the shoulder complex also. The shoulder complex is designed in such a way that to serve the hand only. Here this elbow complex is also designed, the joints which are designed in the elbow complex and the muscles which are crossing over this elbow complex are mainly used to serve the hand. Okay, so this elbow complex joints as well as the muscles provide mobility for the hand in space by apparent shortening or lengthening the upper extremity. So if you consider this one as the upper limb, so this is the elbow complex. So for shortening, so that means when the elbow is flexed, the upper arm is shortened, and when it is extended, the upper arm is extended. So whatever this lengthening and shortening of the upper extremity is to provide mainly to enhance the function of the hand. Okay, so this function allows the hand to be brought close to the face for eating or placed at a distance from the body equal to the length of the upper extremity. So for eating purpose and for anything, not only eating, that means the hand is brought close to the face, one is the thing, and also if you want to, for that shortening of the upper extremity taking place, that is elbow joint flexion, and also combined with supination and pronation is taking place there, and also to keep some objects, or if you want to do some work which are distance from the body equal to the length of the upper extremities. That means how much length of the upper extremity is there, that much distance we can able to do some works. That is the thing here. And rotation at the elbow complex provides additional mobility, that is supination and pronation helps in the additional functions of the elbow complex. Okay. In addition with providing mobility for the hand, the elbow complex also provide stability for skilled or forceful movements of the hand, which are necessary when performing activities when you are using some tools or anything to perform some skilled or forceful movements. So these are the major functions of this elbow complex. Okay, so the main thing is the mobility as well as the stability. So when this mobility is going to occur and when this stability is going to occur in the elbow complex while performing its functions, that is very important. That thing you have to understand in this chapter. Okay, many of the 15 muscles that cross the elbow complex act either at the wrist or shoulder, and therefore the wrist and shoulder are linked with the elbow in enhancing the functions of the hand. So whatever work which are occurring in the elbow complex is to enhance the function of the hand. That is final. Okay, here the joints that compose the elbow complex are the elbow joints, that is humero-ulnar and humero-radial joints. So this is humero-ulnar and humero-radial joints, and the superior and inferior radio-ulnar joints. So the apparent shortening and lengthening of the upper extremity takes place at the elbow joints, which are formed by the distal end of the humerus and proximal ends of the radius and ulna. That is the elbow joint. The elbow joint is mainly formed by the distal end of the humerus and the proximal ends of the radius and ulna. So that is the formation of elbow joint. Whereas this elbow joint allow the motions of flexion and extension and are considered as one compound joint that functions as hinge joint. It is called as hinge joint. Therefore, it is also called as uniaxial diarthrodial joint with 1 degree of freedom of motion. Which joint that is? Only the elbow joint. In the elbow complex, the elbow joint itself. So that means the elbow joint is formed by the distal end of the humerus and the proximal ends of the radius and ulna forms the elbow joint. This joint forms the uniaxial diarthrodial 1 degree of freedom of motion. So in this, flexion and extension takes place in the sagittal plane around a coronal axis. For this joint, 2 major ligaments and 5 muscles are associated with the elbow joint. 3 of the muscles are flexors that cross the anterior aspect of the elbow joint, and the other 2 muscles are the extensor which crossing the posterior aspect of the joint. So that means this joint, particularly the elbow joint in the elbow complex, includes 5 muscles and 2 major ligaments. These 5 muscles, out of these 5 muscles, 3 muscles are flexors that cross the anterior aspect of the joint. The other 2 muscles are the extensors that cross the posterior aspect of the joint. Okay. And the superior and inferior radio-ulnar joint function as one unit. So the superior and inferior radio-ulnar joint functions as one unit, and therefore the 2 joints acting together to produce rotation of the forearm having 1 degree of freedom of motion. So this proximal and distal radio-ulnar joints acts as a single unit and performs a rotatory motion, that is also a 1 degree of motion here. And the joints in these joints are also diarthrodial uniaxial joints of pivot type. So this proximal and distal joints are pivot type, whereas the elbow joint in the elbow complex are hinge joint. Both are uniaxial joints as well as the diarthrodial joints, and all these will have only 1 degree of freedom, but the types are varied, whereas the elbow joint is the hinge variety, whereas the proximal and distal radioulnar joints are pivot type of varieties. Okay, so here the movements which are taking place in the radioulnar joints are the rotation, that is supination, and pronation takes place, which are taking place in the transverse plane around the longitudinal axis. For these joints, it is having 6 ligaments and 4 muscles are associated with these joints to perform this particular motion. Which motion? Supination and pronation. Many of the muscles are crossing on the anterior aspect of this radius and ulna and the posterior aspect of radius ulna, but we have to consider the muscles which are used for the particular action of this proximal and distal radioulnar joints. So what are the movements taking place in the proximal and distal radioulnar joints? That is the rotation, supination and pronation. What are the muscles which helps in this supination and pronation are important here. So we have very much considered about these muscles which are involved in such kind of movements. Okay, so for that reason, so this joint will have 6 ligaments and 4 muscles are associated with these joints, and 2 muscles for supination and 2 for pronation. Whereas the elbow joint and the proximal radioulnar joint are enclosed in a single joint capsule, but it is having distinct articulations. So for this proximal radioulnar joint, it will not articulate with the capitulum and trochlear. So this radius is articulating with the ulna here. So the articulations are different, even though they are all enclosed in a single capsule. Okay. So in this chapter, we are going to study what are the articulating surfaces of the elbow complex joints, and what are the structures which are giving stability, and what are the structures which help in mobility, on which axis all these movements are taking place, which all comes under the structure and function of the humero-ulnar and humeroradial, and also the superior and inferior radioulnar joints. Okay, and after that we are going to study the mobility and stability separately of this elbow joint, and finally the effects of immobilization and injury to all these structures. What are the things are going to happen in such kind of injuries and immobilization, and also we are going to discuss a particular condition called tennis elbow in this chapter. In the next session, we are going to study the structure of the humero-ulnar and the humeroradial joints. These are the joints present in the elbow joint. Okay, so in the next session, we are going to see the structure of elbow joint. Thank you.